A patient once sat across from me and said something I hear very often. He looked genuinely worried and said, "Doctor, I stopped eating fruit completely because of my diabetes. I didn't want to make my sugar worse." I asked him a simple question. He paused. He didn't know how to answer, because no one had ever explained that not all fruits behave the same way in the body, and more importantly, not all fruits affect A1C the way people fear. That moment is exactly why I'm making this video. Which fruit? When people hear the word diabetes, fruit is often the first thing they remove from their diet. Apples, bananas, oranges. All of it disappears overnight. And while that decision comes from a place of fear and responsibility, it's usually based on incomplete information. What most people don't realize is that A1C doesn't respond to fear-based restriction. It responds to patterns, timing, consistency, and how your body processes sugar over weeks and months. That's where confusion begins. Before we talk about one specific fruit, we need to understand what A1C actually measures, because many people misunderstand it. A1C is not your sugar level today, it's not yesterday's reading, and it's not even this week's. A1C reflects your average blood sugar over roughly the last 2 to 3 months. Think of it as a long-term story, not a single moment. This is why someone can have normal fasting sugars yet still have a high A1C, and why someone can panic over one high reading even though their overall control is improving. This misunderstanding leads to extreme choices. People cut out entire food groups, skip meals, or live in constant anxiety around eating. Over time, that stress itself can worsen blood sugar control, cortisol, sleep disruption, and irregular eating patterns all quietly push A1C upward. So, when someone tells me they have eliminated fruit completely, I don't immediately praise or criticize. I try to understand what led them there. Here's where the apple comes in. The apple is one of the most feared fruits among people with diabetes. It's sweet, it's common, and it's often labeled as sugar. But sugar alone does not tell the full story. An apple is not juice, it is not a dessert. It is a whole food with fiber, water, and plant compounds that change how sugar enters the bloodstream. That difference matters, especially when we're talking about A1C. When you eat an apple whole, you're not just consuming natural sugars. You're also consuming soluble fiber, particularly pectin, which slows digestion. This slowing effect means glucose enters the bloodstream more gradually rather than spiking sharply. Sharp spikes, repeated over time, are what tend to push A1C higher. Gentle rises that return to baseline are far less damaging in the long term. This is a critical distinction that most people are never taught. But here's where I want to be very clear. I am not saying apples lower A1C. I am not saying apples are a treatment. And I am definitely not saying everyone with diabetes should eat apples freely. What I am saying is that when eaten correctly, in the right portion, and at the right time, apples do not behave the way most people expect. And for some individuals, removing them completely may actually remove helpful nutrients that support metabolic balance. Another reason apples create confusion is how people compare them to blood sugar readings. Someone eats an apple, checks their sugar shortly after, sees a rise, and immediately assumes damage has been done. But A1C doesn't work that way. Short-term rises are normal. What matters is how high the sugar goes, how long it stays elevated, and how often that pattern repeats. An apple eaten mindfully does not usually create prolonged elevation, especially when compared to refined carbohydrates or late-night snacking. We also need to talk about context. Apples are rarely eaten alone in real life. People eat them with meals, after meals, or sometimes as snacks. The body responds very differently depending on what else is present: protein, fat, and even the time of day. All influence how sugar is handled. This is why blanket statements like "fruit is bad for diabetes" are not just inaccurate, they're incomplete. There's another important factor people overlook: what replaces the apple when it's removed. Many people stop eating fruit but then turn to crackers, processed snacks, or artificially sweetened foods. These alternatives often have a much worse effect on blood sugar patterns and overall metabolic health. Over time, this substitution quietly worsens A1C while giving the illusion of control. In clinical practice, I've seen people panic over fruit while ignoring sleep, stress, meal timing, and inactivity, all of which often have a stronger influence on A1C than a single piece of fruit. When we focus on the wrong enemy, we miss the real drivers. That's why this conversation matters. I also want to address something important for those who monitor their sugars closely. A continuous glucose monitor or fingerstick reading can be useful, but it should be interpreted calmly. One spike does not define you. One apple does not undo months of progress. What matters is the overall trend. The story your body is telling over time, A1C is a reflection of that story, not a punishment for one choice. So, in this video, we're going to look at the apple honestly and realistically, not as a hero, not as a villain, but as a food that behaves in specific ways depending on how it's used. In the next part, we'll talk about how apples affect blood sugar differently based on portion size, timing, and food pairing, and why some people do better with them than others. We'll also discuss common mistakes that turn a neutral food into a problematic one. For now, the most important takeaway is this. Fear-based eating rarely leads to stable A1C. Understanding leads to control. When you understand how a food behaves in your body, you regain confidence, and confidence, combined with consistency, is what actually improves long-term numbers. If you've been avoiding fruit completely out of fear, this is not an invitation to rush back to it. It's an invitation to pause, learn, and make informed decisions instead of reactive ones. Your A1C is not controlled by one food. It is shaped by patterns. And patterns can be adjusted calmly, step by step. In the next part, we'll go deeper into the apple itself, how it interacts with digestion, insulin response, and daily routines, and why how you eat it often matters more than whether you eat it at all. Now that we've clarified why fruit, and specifically apples, are often misunderstood in diabetes, let's slow things down and talk about what actually happens in the body when an apple is eaten. This is where most explanations go wrong, because they either oversimplify or overcomplicate the process. My goal here is neither. I want you to understand this in a way that feels practical and usable in real life. When you eat an apple, digestion begins in the mouth and continues through the stomach and small intestine. The sugars in the apple are not absorbed immediately. They are wrapped in fiber, water, and plant compounds that slow the process. This is very different from drinking apple juice or eating something sweet without fiber. Fiber acts like a brake. It delays how quickly glucose enters the bloodstream, which reduces sharp spikes. Over time, fewer sharp spikes usually mean less stress on insulin regulation. And that matters when we talk about A1C. One of the most important components of an apple is soluble fiber, particularly pectin. Pectin forms a gel-like substance in the digestive tract. This slows carbohydrate absorption and helps stabilize post-meal blood sugar levels. From an A1C perspective, this is helpful because long periods of elevated sugar are more damaging than brief controlled rises. The body can handle gentle increases. It struggles with repeated sharp surges. Another factor that's often ignored is chewing. Whole apples require chewing, which naturally slows eating. Slower eating allows hormonal signals, like insulin and incretins, to respond more appropriately. This is one reason whole fruit behaves differently from processed carbohydrates. Even when sugar content appears similar on paper, numbers alone don't tell the full story. Now, let's talk about portion size, because this is where apples can become a problem. If misunderstood, one medium apple is very different from 2 or 3 apples eaten back to back. More sugar means more glucose load, regardless of fiber. For most people with diabetes, half to 1 medium apple at a time is a reasonable portion. Beyond that, the balance begins to shift, especially if activity levels are low or insulin sensitivity is reduced. Timing is another critical piece. Eating an apple on an empty stomach, first thing in the morning, can lead to a higher rise in blood sugar than eating it after a meal. That's because there's no protein or fat present to slow digestion further. When an apple is eaten after lunch or dinner, or paired with something like nuts, yogurt, or eggs, the blood sugar response is usually smoother. This pairing principle matters far more than many people realize. Evening timing deserves special attention, because we're talking about A1C, late-night snacking, especially close to bedtime, often worsens overnight blood sugar control. The body becomes less insulin sensitive at night, and physical activity is lower. Eating fruit late in the evening, even something as simple as an apple, can keep blood sugar elevated for longer periods during sleep. Over weeks and months, this pattern can influence A1C. That's why apples are generally better earlier in the day or as part of a main meal rather than as a late-night snack. Another common mistake is turning apples into health desserts. Apples dipped in honey, apples blended into smoothies, or apples paired with refined carbohydrates behave very differently from a plain apple eaten whole. Blending removes the natural structure of the fruit and allows sugar to be absorbed more quickly. Smoothies, even when made from whole fruit, often lead to higher and longer blood sugar elevations compared to eating the fruit intact. I also want to talk briefly about glycemic index because it's often misunderstood. Apples have a relatively low glycemic index, but that number alone doesn't determine impact, glycemic load, which considers portion size. Matters more, a small amount of a low GI food can be helpful, while a large amount can still cause problems. Again, moderation and context are everything. Some people notice that even small amounts of fruit raise their sugar more than expected. This doesn't mean apples are bad. It means individual responses differ. Factors like insulin resistance, gut health, medication timing, stress levels, and sleep quality all influence how your body handles carbohydrates. This is why blanket rules rarely work. What matters is observation over time, not fear in the moment. In clinical practice, I've seen patients improve their A1C not by eliminating apples, but by adjusting how and when they eat them, eating apples earlier in the day, pairing them properly, reducing portion size, and avoiding juices or smoothies often makes a noticeable difference. The apple itself didn't change. The pattern did. It's also important to mention what apples replace when used thoughtfully. When someone eats an apple instead of a processed snack, refined carbohydrate, or sugary dessert, the overall glycemic burden of the day often improves. Apples bring fiber, hydration, and satiety, all of which can reduce cravings later on. This indirectly supports better blood sugar control across the day, which ultimately influences A1C. Now, let's be honest, apples are not for everyone. Some people with very sensitive blood sugar responses may still need to limit fruit more strictly. Others may tolerate apples well, but struggle with bananas or grapes. The goal is not to force apples into your diet, but to remove unnecessary fear and replace it with understanding. Knowledge gives you flexibility. Fear removes it. As we move forward, the most important question isn't, can diabetics eat apples? The better question is, how does my body respond? And how can I work with that response instead of fighting it? That mindset changes everything. It shifts you from restriction to strategy. In the next part, we'll talk about who benefits most from including apples, who should be more cautious, and how to make calm, sustainable decisions that support A1C without stress. We'll also bring everything together into a simple, realistic framework you can actually follow. For now, remember this. Apples don't act alone. They act within patterns. When you understand the pattern, you gain control. And control, not fear, is what improves A1C over time. At this point, a natural question comes up for many people. So, who actually benefits from including an apple, and who should be more cautious? This is an important question, because diabetes is not the same for everyone. Two people can eat the same food and have very different responses. Understanding where you fall on that spectrum helps you make decisions calmly, without guessing or copying someone else's routine. People who tend to do best with apples are those whose blood sugar rises moderately and returns to baseline within a reasonable time. These are often individuals with early type 2 diabetes, prediabetes, or those whose A1C is elevated but stable. For them, a small portion of apple eaten with or after a balanced meal often fits well into daily life without disrupting overall control. These individuals usually benefit from the fiber, satiety, and nutrient density apples provide. On the other hand, people who struggle the most with apples are often those with very high insulin resistance, poorly controlled diabetes, or frequent overnight elevations in blood sugar. In these cases, even small carbohydrate loads can linger longer than expected. For them, apples may still be possible, but require more careful timing, portion control, or may need to be limited until overall control improves. This isn't a failure. It's simply an honest response from the body. Medication also plays a role. People taking insulin or medications that increase insulin release need to be particularly mindful of timing and consistency. Eating fruit unpredictably can lead to fluctuations that complicate management. In contrast, those on medications that improve insulin sensitivity may tolerate apples more smoothly. This is why personalizing nutrition matters more than following generalized rules. Another factor worth discussing is activity level. Someone who walks regularly, especially after meals, often handles carbohydrates better than someone who remains sedentary. Even a short walk after eating can help muscles absorb glucose more efficiently. Over weeks and months, this simple habit can reduce overall blood sugar exposure, which directly affects A1C. When apples are combined with movement, their impact often becomes more manageable. Sleep quality is another quiet influencer. Poor sleep raises insulin resistance and stress hormones, making blood sugar harder to control the next day. In someone who sleeps poorly, even a well-planned diet can feel ineffective. This is why focusing on one food alone rarely solves the problem. Apples can fit into a supportive routine, but they cannot overcome chronic sleep deprivation. Stress deserves attention as well. Chronic stress raises cortisol, which raises blood sugar. Many people focus intensely on food while ignoring stress, only to feel frustrated when numbers don't improve. If stress is high, the body may respond poorly even to small carbohydrate loads. Addressing stress doesn't require perfection. Even small calming routines can make blood sugar patterns easier to manage. Now let's talk about how to decide whether apples belong in your routine. The most helpful approach is not fear, but observation. If you monitor your blood sugar, notice what happens when you eat a small portion of apple in a controlled setting. Eat it with a meal, not alone. Check how high your sugar rises and how long it takes to come back down. Look at trends over days, not single readings. This information is far more useful than rigid rules. It's also important to avoid all or nothing thinking. Many people either eat apples freely or avoid them completely. A more realistic approach sits in the middle. An apple a few times a week, eaten intentionally, is very different from daily large portions eaten late at night. Flexibility allows you to adjust as your A1C improves, or as your body's response changes. One thing I always emphasize is that no single food lowers A1C on its own. A1C reflects the cumulative effect of thousands of small decisions: what you eat, when you eat, how you sleep, how you move, and how you manage stress. Apples can be part of a supportive pattern, but they are never the whole pattern. This perspective matters because it removes pressure. When people believe one food holds all the power, they either cling to it or fear it. Neither approach leads to long-term stability. Understanding removes emotional weight and replaces it with calm control. As we wrap up, I want to return to the patient I mentioned at the beginning. When we talked through his routine, we didn't add apples immediately. We first focused on meal timing, evening habits, and consistency. Once his A1C began to stabilize, we slowly tested foods he had been avoiding. When apples were reintroduced carefully, they didn't cause the chaos he expected. What changed wasn't the apple. It was his understanding. That's the message I want you to take with you. Diabetes management is not about punishment or fear. It's about learning how your body responds and working with it. Foods are tools, not enemies. The more you understand them, the more control you gain. If you've been avoiding apples out of fear, this video is not telling you to start eating them freely. It's encouraging you to replace fear with knowledge, ask better questions, observe patterns, make decisions calmly. That approach is far more powerful than strict avoidance. In the end, A1C improves when your daily routine becomes predictable, balanced, and sustainable. Apples may or may not fit into that routine for you. And that's okay. What matters is that your choices are informed, not reactive. Understanding your A1C gives you confidence. Confidence reduces stress, and reduced stress, combined with thoughtful habits, often leads to better numbers over time. That's how real progress happens. Quietly, steadily, and without extremes.